Background information about voice and message banking. The loss of one's ability to communicate, even temporarily, can be frustrating and stressful. This stress and frustration is not only felt by the individual who is unable to communicate, but by the individual's family, friends, and others as well. John Costello, speech-language pathologist and director of the Augmentative and Communication Program at Children's Hospital Boston, states that nursing staff and other medical professionals have reported difficulty understanding their patients' attempts to communicate. Furthermore, family members have feelings of anxiety as a result of their inability to communicate with their loved one, and their loved one's inability to communicate their wants and needs. In the case that an individual loses their ability to communicate, there are augmentative and alternative communication options available to assist the affected person in communicating. Collaboration among professionals to select an AAC device that best fits the patient's needs is important. When an individual anticipates a temporary or permanent loss of speech, voice and message banking may be a good AAC option. Possible candidates for voice and message banking include, but are not limited to, the following: those with degenerative conditions, those who are planning to undergo a laryngectomy, those who require reconstructive oral surgery, and those who are on a vent or intubated. Voice banking, by definition, is a process of recording a large inventory of your speech that is then used to create a synthetic voice that approximates your natural voice. These recordings are put onto a speech-generating device and allow the patient to spell and create any message they would like to. The voice output that results is an approximation of the patient's natural voice. Additionally, message banking with your own voice allows you to digitally record and store words, phrases, sentences, personally meaningful sounds, and/or stories using your natural voice, inflection, and intonation. These pre-recorded messages are stored as .wav files, which may be linked to messages in an array of AAC devices or sound storage files. Message banking allows the patient to create messages by combining their pre-recorded phrases, words, sentences, sounds, and/or stories. Message banking does not, however, allow the individual to create novel messages. Message banking by proxy is the election of a proxy voice to do all recordings because issues of fatigue, pain, or intelligibility may make it difficult for an individual to bank all messages. Because a proxy's voice is utilized instead of the patient's, this technology does not create a natural voice in the sense that voice and message banking with your own voice does. However, it does create another human's natural voice, which may be an advantage compared to other AAC options that utilize a computer-generated voice.